Thank you for joining us for the May 13th Sacramento County Public Health Media Briefing. Just a reminder to please stay on mute while our staff is presenting, and then we'll have a chance for questions at the end. I will go ahead and hand it over to Dr. Olivia Cassirier.
Helps to unmute. Good morning, everyone, and thank you again for joining us. So according to the numbers, we are at 104,840 cases of COVID-19 reported to Sacramento County. That is data from this morning. Our daily average is about 105 cases per day, and the case rate has continued to drop, and this morning it was 6.7 per 100,000. According to the blueprint, the update from Tuesday, the case rate is at 7.3 per 100,000. So that still puts us in the red tier, but we are still hopeful, still putting out hope that we will get to the criteria for the orange tier before June 15th. The other update is that I know that there was some questions about the masking and what that's going to look like after June 15th. We do know that the blueprint will be retired, and so all of the guidance, the sector-based guidance that is related to the blueprint will be retired as well. But the state's executive order will remain, which does include guidance for masking. We know that the CDC has made some changes recently, so has updated it, especially for people who are vaccinated. And so we will continue to use that guidance. And if there are additional changes from the CDC, the state guidance will be updated as well. With that, I will turn it over to Jamie to give an update about our efforts for vaccination in Sacramento. And then Rachel will talk about the update with being able to vaccinate children from 12 and up.
Hey, good morning. So as mentioned briefly last week, we're kind of shifting our strategy for vaccination, moving away from more of a mass vaccination model to more targeted clinics with an aim for as much accessibility as possible. So the plan right now is to continue doing, having Cal Expo be open in a drive-through fashion as our primary largest site, operated now by our partners Curative. And tentatively that will go through September. However, other sites we're transitioning to the smaller scale clinics. So Curative also currently operates McClellan as a large drive-through, and that's going to be transitioning over the next month to an indoor clinic. We are finalizing plans to actually have an indoor clinic starting this Saturday out at McClellan, and they do Pfizer, so that would be available to 12-year-old and older, and there'll be weekends, and then eventually they will also add a Friday clinic. And so this is to try to get, to make it more accessible to individuals who can only come on the weekends, who maybe work Monday through Friday. And then we are still moving forward with Consumnes River College, and similarly, that will be more intermittent, smaller clinics, not a large drive-through site there. So we are probably having them either in their cafeteria or in a covered area that's under a parking structure. And we've been working with their administrative leadership. They're really excited. They're just as eager as all of you are to get this up and running. Next week, they do have all of their graduation ceremonies happening. So we will probably get something started after those are done. And again, they will be intermittent to work around other events that they are planning over the summer. And with that, I will pass it to Rachel.
Hi, good morning. I have our allocation numbers for you for next week. Sacramento County providers have available to us 39,870 doses of COVID vaccine. That's 24,570 doses of Pfizer, 11,500 Moderna, and 3,800 Johnson & Johnson. And then, as Dr. K said, starting today, exciting news that youth ages 12 to 15 can be vaccinated with the COVID-19 vaccine. And it does need to be Pfizer vaccine. So ages 12 through 17 can receive a vaccine, but that age population needs Pfizer. So earlier this week, the FDA gave their approval, and then yesterday the CDC Advisory Committee met and made the recommendation as well. And then in California, we wait for the Western State Scientific Review Work Group to also look at the data, and they also concluded that the vaccine is safe and effective for youth ages 12 to 15. An additional statement came out from the Academy of Pediatrics that supports the co-administration of the COVID vaccine with other routine immunizations in order to get kids caught up on missed immunizations. So that's going to be very helpful. So I wanted to just reiterate again the sites that we have with Pfizer. You can visit our Sacramento County website, and they're pretty clearly delineated there as well as on my turn. But the large throughput sites, the curative sites at McClellan and at Cal Expo use Pfizer, as does Sac State and Cal North State. The Urgent Care Now clinics and pop-ups use Pfizer, and Grant High School as well. But we're also working with the school districts and the Office of Education in conjunction with our partners, both hospitals, pharmacies, and other providers, to offer large throughput vaccination sites at each of making sure there's a few in each district. And those will be available not just to kids, but we want them to bring family and community members as well. And then there'll be ongoing efforts with the schools, going forward, making sure that we're in more locations and that we have equitable access. So we met this morning again with the schools and the school nurses, and that plan will continue to move forward. And then the third option for families, of course, is that the state is working with all of the providers that offer pediatric providers, the Vaccine for Children's program, to get them enrolled as vaccine providers in the COVID vaccine program. And so they're doing a rapid enrollment, and we are in communication with all of those practices as well. And so we expect Pfizer vaccine to be available in most provider offices. Pfizer comes in a large quantity, so we'll be doing redistribution out of our office and taking providers smaller amounts so that they can have a usable quantity on site. And so I think this is going to be a great step towards reaching herd immunity and getting back to life as we know it. So, and then I will turn it over to Megan Sheffield.
Thank you. Hi, everyone. In keeping with Jamie mentioned earlier about moving towards smaller community-based clinics, Public Health is excited to announce that we're able to deploy 2 new mobile operational support units that we'll be utilizing as mobile vaccine clinics throughout Sacramento County. This will allow us to provide vaccine support to communities that have had less access to vaccine. The mobile support units were built by TDP Trailers and are currently stocked to provide vaccine support. We are coordinating several clinics throughout the community in conjunction with our California National Guard partners. We'll start next week by visiting every district in the county. We'll have a clinic on May 19th in the 95832 zip code. On May 20th, we'll be in 95821. And on May 21st, we'll be in 95838. The following week, we'll be hosting clinics in 95673 and 95632. The dates and times of locations will be provided to the media soon, if you guys are interested in coming out and seeing how the trailers will be utilized. And then we'll be adding additional sites throughout the community as soon as we have confirmed locations.
Thank you, Megan. Okay, so that concludes our update. We will go ahead and open it up to questions. We have a lot of outlets here, so if we can please utilize the raise your hand function or the chat. And we can start with Renee Santos from CBS 13.
Good morning. My question is, today is the first day that new age group, 12 to 15-year-olds, can get the shot. What is the verification process now to ensure that kids are in fact going, they have permission from a parent or a legal guardian? That we know from the state, at least they told me, that a parent or guardian can have a documentation that's signed if someone else does take them, that's an adult, to get the shot. Just curious to know in the county what the verification process is to ensure that the kids that are getting the shot are in fact allowed to by their parents.
So most of the sites are using My Turn, and My Turn updated this morning, I believe at 8 a.m. To have the proper consent built in. Most of these, we've tried to communicate. We meet with our providers every week, and we've gone over every week with them the consent process of what's involved and when you need a parental consent and when you don't. And all of our providers are committed to vaccinating children as long as the consents are in place and verified. If a child does come without a parent, I think one of the asks we have is just to make sure that they have someone to help transport them in case they might not be feeling well after the vaccine.
Okay, I have Chelsea Shannon from ABC 10.
Hi, our questions are very similar with the 12 to 15-year-old. Specifically, what should teens do if they're in a situation where their parents are hesitant and not wanting them to get the vaccine and will not give the consent, but the teen wants the vaccine?
We encourage in those situations that the teen reach out to have the discussion with the parent and encourage the parent or both of them to actually talk with a medical professional. They can either talk to a pediatrician or they can call public health and have the discussion so that we can address any concerns that the parent might have about vaccination.
Okay, Chris Hooks.
Thank you. Chris Oakes, Cap Radio News. I was wondering, quick follow-up from last week's question on the missing second dose cases. Is any demographic data available for that yet? Or
Hi, yeah, thanks, Chris, for bringing that up again. I'm actually really glad that you asked that question last week. So what we noticed was, compared to the general population who's been vaccinated, those who have missed second doses, they were more likely to be age 65 and plus. And so one of the things our team has done is we've actually generated a line list with contact information of all of those individuals. And we're coordinating with our MRC volunteers and with our MCE partners to do some outreach directly to those individuals through phone calls, possibly through mailers, to try to see, one, if they did get a second dose and it didn't get recorded, then to make sure that that happens, and then also two, to connect them with clinics where they can get a second dose. And so I think, Jana, you'll send that information out after this meeting. Is that correct?
Yes, I will send out that data.
Right. But in terms of other demographics, race, ethnicity, even H1 quartile, they were very similar to the general population that has been vaccinated.
We've got Susanna from Telemundo.
Hello, good morning. I have a question in regards to school district collaboration with the county. Is there, I don't know if there's like a protocol or at the discussion that you guys had, if there's any information that we can know about that, of how, any clinics could be held in some of these schools or districts, and when could we possibly be looking, when this would happen?
I'll let Nick Murray answer that question.
So yeah, we've been working closely with our school partners, first with efforts to vaccinate teachers, and now as we look at the ability to vaccinate students. Many of our school district partners have actually established partnerships with the hospital systems and medical providers in the community, and have established efforts with those groups to put together clinics within their districts. As was mentioned, we've been working closely with them over the past few weeks to not only ensure that there are offerings within districts, but really looking more at a granular level to set up clinics within neighborhoods and school sites, really trying to remove as many barriers as possible. And so we've offered several resources to complement those partnerships that they've already established with the hospital systems. That includes our partnership with the National Guard, and several local and national pharmacy chains to really offer these pop-up clinics at an individual school level. So obviously, as we approach the end of the school year here, time is of the essence. We're hopeful to have as many of those clinics happen in the next few weeks so that we can get first doses administered. And then, of course, with Pfizer, 3 weeks later, we'll be looking at a second dose administration. But we also expect these efforts to continue throughout the summer and as we enter the new school year in the fall.
I have a follow-up question kind of on that same line from Genoa from the Observer. Is there an update on the schools initiative that Jim Hunt mentioned during the last Board of Supervisors meeting?
I think that's the one that Nick has been talking about, being able to use school sites as one of the venues for having community clinics. So being able to target not just the students, but also the families. And so the clinics that we're planning that will be scheduled will also be able to vaccinate family members of the students.
Chelsea, follow-up question?
Yes. How available will the vaccine be for teens to go and get it from their pediatrician? And then do we know about how many people are within the 12 to 15 age group that we're expecting to possibly get vaccinated in the coming weeks?
I can answer the first part of that. As long as a provider is willing to offer a Pfizer vaccine in their office, we will get it to them and make sure that that happens. So they do have to go through the enrollment process that the state has for COVID vaccine. But it's, like I said, most pediatric offices are already VFC providers. So this is nothing new to them. They know how to store and administer vaccine. And so we're working very hard and very willing to make that work if they're open to doing that. So I think it will be widely available in pediatric offices and FQHCs, as well as the health system medical offices. And I'm not positive about the numbers. I'm not sure if anyone else on the team has that.
Yeah, if Jamie doesn't have it, we will get it to you through Jana.
Yeah, I can pull the exact number. You want it for ages 12 to 15, what our county population is?
Yeah, that would be great.
Okay.
And also just
I would guess it's about 100,000, but I'll confirm.
16 and older would be great too, just to have it. Thank you.
And then Kris, did you have a follow-up question?
Yeah, a couple quick ones really. So for just to clarify on the, I'm still using last week's numbers that you all provided, but on the total incomplete, whether or not it's within 6 weeks or missed after greater than 6 weeks, is that 6 weeks from the date that they should have gotten their second shot, or from the date that they got their first shot?
On the date that they got their first shot.
Okay. And then second question is, what's the effectiveness of getting the second shot after the initial 2 to 3 weeks that you're supposed to get it? Is that second booster shot still as effective as getting it on that second or third week? Or
from the data that we have from the CDC, yes, it is still very effective. And that is why it's important for us to continue reaching out so that we can get them the second dose.
thank you.
And another follow-up question from Genoa. Can Dr. Casterier speak more on the mask mandate, both now with folks that have both doses and post June 15th?
For the masking mandate that we have right now for people who are have been vaccinated and considered completed the both doses and are beyond 2 weeks of the second dose, they can engage in activities outdoors without masking. They still have to use masks indoors. But right now we are still waiting to see if there are any changes that will be made from the CDC, especially as more and more people are getting vaccinated. We anticipate that they will continue to loosen the restrictions, but at this point, I don't know what it will look like on June 15th.
Okay. I have a follow-up question from Renee.
Hello. So we know that consent is done through the state's My Turn website. So when they have the consent, they fill out the information, book their appointment, they go to a site to get their vaccination. What has to be present? An adult? Can it be an older sibling that's 17? What is that process then once the consent online is done? What are the steps after that?
A youth under the age of 18 can be vaccinated if they have a written consent, which would include, I believe, the My Turn consent without a parent present.
So, but there's no verification as far as, I mean, what if they forge that?
Well, the expectation is that children will not do that because right now, even with the regular vaccines that we give to children, we are dependent on getting written consent forms from parents. And so that will be the same process that we will follow. We know that we've been doing it already for 16 plus, and we have not had any issues. For the younger students, of course, the expectation is that there will be an adult, either a relative or the parent if possible. But otherwise, we will have to take the written consent form with the signature that we have.
Thank you.
Okay, I don't see any other hands up in the queue or anyone queued up in the chat. Do we have any final questions? Antonio?
Yes, this is Antonio Harvey, reporter with the Sacramento Observer. I'm a little late getting into this meeting, Dr. Kassiri. I just want to know, have you been discussing COVID-19 cases among student athletes in the city and county, and if there's anything that you can provide? I know I'm a little late getting into this discussion, but if there's anything that you can provide as far as updates or numbers or cases going up or down, anything.
Yes, we will provide those numbers. I don't have them offhand right now, but we have had cases from time to time among youth athletes. Usually the outbreaks are very small, maybe 3 to 6 students, because once we are notified of the outbreak, we have the team quarantine, and that usually stops the spread. But yes, we have had some cases, and we will provide that information through Jana.
And can I touch base with you offline to provide, I do have other questions if you don't mind.
You can schedule an interview through Jana, please.
Yes, I will. Thank you.
Tony, if you can put your email in the chat, then I can connect with you. But this recording will also be available in its entirety shortly after we conclude, hopefully quicker than it was last week. And you have access to a lot of the information that you're probably looking for through that.
Okay.
One question from KFBK: will vaccinating the 12 to 15 age group help Sacramento County get out of the red tier? Why are we still stuck here?
Well, we just have a few more weeks left before June 15th, so I do not know. But looking at our numbers right now, we are starting to trend downwards. We were in a plateau for quite a while, but the numbers have started declining again. So we'll continue to observe and still continue to hold out hope that we will meet the criteria for orange before June 15th.
Thank you. Okay, that will conclude our media briefing for today. As a reminder, we have quite a bit of data to follow up on that I will send out an email in addition to the link for this entire recording that can be used. And we will see you guys next week for the Sacramento County Media Briefing. Thanks.